Dr. Paul here. We've got a little one with a rash we're gonna go take a look at. Let's go look. Hey, you got a really big rash. Yes, you do. It's like, oh my goodness. So, tell me the story. What happened?
So Sunday night, she developed a few little welty type spots more on her groin area.
Okay.
And then she's had this before, and we sort of thought that maybe it was related to a fabric softener. We switched that. It kind of resolved on its own, and then it was back again. And then it significantly got worse over the last 24 hours. Just blew up everywhere, all over her body, really quickly.
It sure did. And is it coming and going a little bit?
It is a little bit this morning, but
Yeah.
we did give some Benadryl last night.
Okay.
3 doses altogether since last night. So, and it's actually improving.
Okay. Do you see that cute baby in the mirror? You see that cute baby in the mirror? Yeah. Yeah. Over here.
But it doesn't seem to be bothering her.
See that cute kid? Who's that? There you are. Uh-oh. I got it in the face. You can pick her up. You can pick her up.
It's okay. Come here.
All right.
Here we go.
So, has she had any other symptoms
A
like
little bit of
runny
congestion.
nose? Yeah.
Mhm.
And that started around the same time?
She's been having it off and on for a few months.
Okay. Perfect. Trick you. That one's okay. Here we go. And say, ah. Perfect. Good job. And how about food? What's her diet like?
She eats everything.
Yeah. Any peanut butter, nuts, nut family?
No, she hasn't really had any nuts.
None of that yet? Breastfeeding still?
Yes.
Have you changed your diet, or did you eat nuts or nut
I
family?
eat nuts, but I've had nuts
Before.
forever.
Yeah. Shellfish,
No,
shrimp,
not really.
lobster, crab,
we've
oysters.
Well, rarely.
Yeah.
Pretty rare.
But related to this.
No.
Is she on any antibiotics?
No, she's
Are
not.
you on any antibiotics?
No.
No. Okay. So what I'm running through is the list of things that can cause hives. I would say for our viewers, the number one cause is unknown. You're right, we never figure it out. I think at the top of the list is viral illness. And so that fact that she's had a cold, that's probably it.
That's what we're thinking.
You never want to miss antibiotics, right? If you have hives to antibiotics. And the thing about hives is they have that classic target lesion. There's a few here on her shoulder. If you kind of bring the camera close to her shoulder back there, you'll see a little central clearing and then the red ring around it like a target. And that's classic. And the fact that they come and go is another classic aspect. So it's probably the viral illness. We want to make sure it's not antibiotics, which it isn't. The other big category for hives is foods. And so the top foods that cause hives or allergies would be the nut family, shellfish, that type of seafood, not so much fish, but the shellfish. Shrimp, lobster, crab, clams, oysters, that category. This is an allergic reaction. So with an allergic reaction, you want to make sure they're not having any trouble swallowing.
Right.
And she's swallowing fine, right?
Yeah.
Still nursing well.
Oh, yeah.
And no trouble breathing, like wheezing. So I'm going to sneak a listen without getting too much in your space. You sound perfect. Like peekaboo. Peekaboo. Just a little bit. Just a little smile. Alright, so this is hives. As far as the treatment for it, if there's no trouble swallowing, no trouble breathing, it's just, maybe you're itchy from the rash, so you could use loratadine, which is Claritin, the compound that Zyrtec is. They do make it for kids. I'd probably stick with the loratadine, I think, at this infant age.
Okay.
Half a teaspoon a day.
Okay.
Or Benadryl, be about a teaspoon every 6 hours or so as needed.
Okay.
Which is diphenhydramine for the viewers. And as long as there's no swallowing problems or breathing problems, you're okay. Yeah. Is that all right?
And it doesn't look like it's a external, like laundry type
No,
thing or
I
clothing.
think this is coming from within.
Okay.
Yeah,
Yeah.
some either infection or something that you've ingested.
Okay.
Yeah.
All right.
Excellent. We just got a nice case of hives. Thank you for letting our viewers watch and learn about hives. Tickle, tickle, tickle.
Thank you.
Thanks for watching. I'm Dr. Paul.